37 million Americans suffer from migraines a year. Of those, the majority are between 35 and 45, and a lot of them are caused from their eyes. I'm going to tell you what I know. Stick around. Welcome to the EyeCare Wellness channel. I'm Joel Hayden. If you haven't been here before, we talk about all things optometry, nutrition, eye nutrition, and ways in which we can live longer and better. So if that interests you, consider subscribing, hit that like button, and let's get at it. 43% of women in their lifetime will have a migraine, where only 18% of men in their lifetime will have a migraine. So it's 2 to 1, women over men, which I clearly see. I would actually have put it more like 5 to 1 or 6 to 1 in my experience, but it's definitely way more women than men. There's a myriad of reasons why migraines occur. They can be stress, lack of sleep, dehydration, alcohol, coffee, weird or pungent smells, smoking, hormones, and exercise. Over the course of my career, we were always taught in school that foods was the #1 cause of migraines, which I do not believe at all anymore. We were told it was nuts, red wine, MSG, chocolate, caffeine, and alcohol. I'm not so sold that that's the majority. First of all, that big difference between women and men, that's hormones. And when I have a patient in that's describing their headaches, I'll ask if there's any pattern, and many times the women will go, oh, it's absolutely a cyclical pattern. It's hormones. Unfortunately, it probably is. I think stress is one of the top causes, especially in men. The amount of stress that we go through can be crazy. And at those times in our lives when stress is really high, it's when a lot of people who get migraines get them. Exercise is another one. I have a friend, she does a lot of CrossFit. I do a lot of CrossFit. When she's doing her cleans, it jacks up all the muscles, especially the small muscles in her back, radiates right up the top, and boom, can throw right into a migraine. So I've seen that many times. Very common. So that's at least one of the top 5 reasons. But one of the top reasons I see migraines, I really will try to work on patterns. Where does it happen? When does it happen? Time of day. And if I can pinpoint that it happens when my patients are at work and they tend to work on a computer, well, the computer has a flicker rate, and all computers do. And they're usually working, even though many people are working from home now, they're usually working under fluorescent lights when they're at their office. So the fluorescent lights definitely have a flicker rate. Some people can actually detect it by just looking at them. Their retinas are that sensitive. But the flicker rate coming off of the fluorescent light and the flicker rate coming off of the computer, those peaks and valleys meet at the wrong place, and wham, can throw you right into a migraine. And usually those people will have an aura at first. They'll notice that something's off, and they notice that they're either missing part of their field or that they're getting some really weird visual disturbances. It can also happen when a car goes by and on a bright sunny day and the reflection of the sun bounces right into your eye. That can throw you right into a migraine, especially a migraine aura, which will then last about 20 minutes, subside, and then the headache starts to come. So if you happen to be one of those people who get the aura before the migraine, take what you usually take for the pain when you get the headache, and take it when you get the aura. And that way, it'll be in your system and working, and the headache won't be as severe when you get it. By the way, some people will get the aura and never get the headache, and that happens a lot too. Usually terrifies them. Those are my screaming phone calls of somebody pulled over on the side of the road on a Sunday morning. And I have to just assure them that in 20 minutes it'll be gone. And if it does truly go away, all is well. Especially if they're younger, we have to be a little bit worried of stroke-like symptoms if they're older. And we got to kind of try to figure out which we're looking at. So what do you do? What do you do if you're one of those people who are getting the aura and getting migraines because of the fluorescent lights in the computer, well, good news. There's actually a certain tint called There is a certain tint called FL41. And FL41 you can find right on Amazon. Try to get a lighter one. The darker ones just can almost be disturbing because they're a little bit too dark orange. I've put them into patients' prescriptions before, so that can be done as well. And it does a great job of reducing the fatigue on the computer under the fluorescent lights. Blue light blocking glasses will help to some degree, but if you truly are getting migraines, skip it. Go right to the FL41 tint. I'm going to put a link to some of them in the description box down below, especially the ones that we've had in and tested out. And then lastly, just go get an annual eye exam. Make sure everything's okay. And your optometrist will do that and give you guidance as to what you should do when you're doing all that work for hours and hours and hours and hours at a time on the computer. Hope this was helpful. If it was, consider subscribing, hit that like button, and until next time, take care.